wanted to welcome everyone. My name is Rachel Fernbach, and I'm honored to serve as the board chair for Mental Health News Education. I'm also the executive director and general counsel of the New York State Psychiatric Association and a partner at the law firm Nordhock and Hemroth. And it is my pleasure to welcome you to our 2025 Leadership Awards reception. And thank you for being here. Our annual leadership reception has become a cherished tradition, bringing together leaders from the behavioral health and autism communities. Whether you are joining us for the first time or have been with us year after year, your support is invaluable and we thank you for it. We are proud that our annual Leadership Awards reception has become a great tradition, gathering leaders like yourselves from both the behavioral health and autism communities. Sorry, got mixed up. Okay, and so we just wanted to thank you for all your support. On your tables, you'll find event packets with information about our distinguished honorees and generous sponsors. So you can please scan the QR code on the front cover. That's where you can access the journal from today's event. And also we'll send a follow-up email after the event with more information. Okay, so now let's get to the really important stuff. So we're especially grateful to this year's honorees, our stars of the day, who we'll be hearing from shortly. So first we have Lauri Cole. I'm looking everywhere but in the right place. No, we've never met, but I'm thrilled just Zoom. So I look forward to chatting later. So Lauri is the executive director of the New York State Council for Community Behavioral Health Care, and she's receiving the Behavioral Health Advocacy Award. So thank you. And then here we have Friedman. Who is partner at the law firm Ropes & Gray, and he'll be receiving the Healthcare Innovation and Leadership Award. Okay. Next we have our corporate award, our Corporate Leadership Award, which this year goes to PharMerica. Thank you. Next we have Sullivan. Who is Executive Vice President at Ostroff Associates, and he'll be receiving the Autism Advocacy Award. And last, but certainly not least, we have our very own Ira Minot, founder of Mental Health News Education. He started it all, and he'll be receiving the Founders Legacy Award. So today's a very special day for this organization. Okay. So we wanted to thank you again, extend our heartfelt thank you to all our sponsors, and wanted to just quickly recognize our top level sponsors. We have our platinum sponsor this year, which is Ropes & Gray. Thank you. Our gold sponsor, which is Adapt Community Network. And our silver sponsors, Birch Family Services, Health Management Associates, and Melmar. So thank you for your support. Also, we're deeply grateful to the New York State Office of Mental Health and the New York State Office of Addiction Services and Supports for their generous grant support year after year. Their vital contributions enable us to really continue our mission of providing crucial education and resources to those in need. Special thank you also to Andy Cleek from the NYU Silver School of Social Work and the McSilver Institute for Poverty Policy and Research for generously donating this space to us year after year. So that's really makes this all possible, so thank you. I also want to just quickly express my gratitude to the Mental Health News Education Board of Directors for your unwavering dedication and leadership, and I'm privileged to work with such a fantastic and committed team. And of course, I would be remiss without, again, thanking Ira and David Minot, your extraordinary, our editors-in-chief and publishers. Your extraordinary efforts have really brought us here Tonight, and Ira, your vision 25 years ago to create a trusted source of education and resources for those living with mental health challenges has really profoundly impacted so many lives. And we've really been able to really share information with those who really needed it. So it's really been wonderful. So on behalf of everyone, I cannot thank you enough for your continued guidance and support and leadership. And so enjoy today's event. Thank you.
Welcome, everybody. Nice to see you at lunchtime instead of dinner for a change. So many friendly, familiar faces. For those who don't know, I'm David Minot, and I want to thank you all for being here tonight as we come together to recognize and celebrate extraordinary leadership in the fields of mental health, substance use disorders, and autism. This event is an important part of our annual fundraising efforts as a small nonprofit organization. So 50-50 raffle tickets are still available for purchase at the registration table where you picked up your name tag. We'll be drawing the winner at the end of the program, so don't miss your chance to participate. This year's event takes place at a time when, as we all know, the need for education, advocacy, and truth has never been greater. Across the country, we're seeing serious challenges, proposed cuts to Medicaid, threats to mental health and substance use services, and rhetoric that promotes fear and misinformation about autism. There are even plans for a national autism registry being discussed, raising real concerns about privacy and trust, while federal and state agencies that support vulnerable populations are facing deep budget cuts. In the face of all this, our mission at Mental Health News Education has never been more critical. Our publications, Behavioral Health News and Autism Spectrum News, exist to be a reliable source of trusted information grounded in evidence and lived experience. We serve over 500,000 readers annually with stories that reduce stigma, inform families, support professionals, and amplify the voices of the most affected. We don't chase headlines, we build understanding, and that's exactly what tonight's about. We're proud to honor a group of individuals and organizations whose leadership, advocacy, and innovation are changing lives and strengthening the systems that support us all. Their work reflects the very best of what we can achieve when we stay focused on dignity, inclusion, and evidence-based care. Each of tonight's honorees brings something vital to our shared mission, and I'm really excited for you to hear more about them through the voices of those who know them best. To all of you here tonight, our readers, contributors, board members, partners, and friends, thank you for your continued support of MHNE. It's really because of you that we're able to do this work, to inform, advocate, and to serve as a platform for progress. So let's carry this energy forward, not just tonight, but in the days ahead, as we continue to stand up for truth, fight for equity, and support the communities that rely on us. So thank you, and let's enjoy an inspiring evening together. Now it's my pleasure to introduce Dr. Ann Sullivan, Commissioner of the New York State Office of Mental Health, to share a few words.
Hi, good afternoon, everyone. Good afternoon. It's a real pleasure to be here, and I would just want to thank David for inviting me to just say a few words. First of all, to thank all of you. Whatever your relationship is to mental health here today, you're here because you really care. And I really want to thank all the providers who are here, who I know do the really tough work every day, all the supporters, all the advocates, all the families, everyone whose concern is for mental health, just like ours is. So thank you, thank you, thank you, thank you on behalf of LMH, and thank you on behalf of the governor, because I know that she truly appreciates all the work, the hard work that's going on across New York, so thank you. And then Behavioral Health News is just a treasure for New York. When I was working at Elmhurst Hospital, I walked into the clinic one day, and there was this newspaper sitting on the side, and I picked it up, and it was Behavioral Health News. And I read it and I said, wow, this really talks to me. It also talks to my patients, it talks to their families, And it's written in such a way that everybody can understand, and it's a tremendous source of knowledge. And so we made sure, while I was there, we always had, and that was the print days, you know, those days of the papers. We had those papers in our clinics in those waiting rooms, so people would pick them up and read them. And I can tell you that we always got great, great reviews. So I can't thank Behavioral Health News enough for what it's done, and expanded to Autism Spectrum News. But you really are a real source of truth, a source of data, a source of the resources that we have. And every month it's my pleasure to have a kind of commissioner's column where I get to talk about something fun that we're doing in New York State. So I can't thank you enough. You know, this is Mental Health Awareness Month, and that's what Behavioral Health News and Autism Spectrum are all about. Awareness, education, and advocacy. So a huge thank you for what you do each and every day. And congratulations to all the awardees. Some I've had the real pleasure of working with. Lauri Cole, in the council, who keeps us on our toes in Albany, and Brad Friedman, who we worked with on Medicaid. I don't really know Mr. Sullivan, but I'm sure with that name, you must be great. I just have to say that. And then also to PharMerica, I keep saying it wrong, for all the great work that you're doing. And then I just have to say a few words about Ira Minot. I don't know if you remember Ira, but I think I met you the first time with Barry Perlman, who was a tremendous supporter in the New York State Psychiatric Association of Behavioral Health News. And that's when we first met, and that was probably a good 24 years ago. And it has been a pleasure for those 24 years since. You know, we all kind of have ideas, and I think we all have our hopes and dreams, but I think you've realized yours with Behavioral Health News. You really had a vision for providing something special that individuals who are really dealing with mental health challenges could use and could get better and recover and have hope. And from your experience, you came forward and you said, I assume, that I will do this for others. I don't think there's any nobler cause than to be convinced that you are doing things which you have done for others, so that anyone in New York who has the availability to get online and look, Behavioral Health News can learn and grow and have hope and believe in recovery and really move their lives forward. And that's a tremendous, tremendous legacy, I know, for thousands of New Yorkers. So thank you. Thank you for all that you've done. Thank you for giving us your son, who will now continue to do the great work. I thank you on behalf of myself and on behalf of the governor too, because I know that she appreciates all the tremendous work that you've done. So thank you so much, and congratulations.
Okay, to start our program, I'm honored to introduce a leader whose work has reshaped the understanding, has reshaped how we understand equity in public health and substance use policy. Tracy Gardner brings over 30 years of experience as a tireless advocate for health equity and justice, particularly in addressing the impact on the war on drugs on Black communities. She formerly led policy advocacy at the Legal Action Center and now serves as executive director of the National Black Harm Reduction Network. Please welcome Tracy Gardner.
You're spoiling me. I think I'm going to want that all the time. Good afternoon, and wow, this is great. I love this afternoon gala thing. I love it. Look at it. Sparkly for Lauri. So I know you also run a tight ship. I thank you for allowing me to introduce my friend, Lauri Cole. Thank you for asking me to introduce you. You are an amazing advocate, teacher, and friend. Lauri got me through some scary days as someone who has always worked on the not-for-profit side, where I met amazing people who are in this room, like Dr. Jen Havens and Pam Mattel, Jeff Reynolds. we worked on the legislative side. And we've worked during some bad times, although this is pretty bad. But Lauri really held me down in a space that was unfamiliar, not especially welcoming, but was really important work to do. So, guess what? Lauri is complicated. Lauri is complicated and passionate, and I've heard those descriptions flung around my way. But when you are outraged by inequities and people being treated poorly, it makes you ferocious. And that's what she is. She's a ferocious advocate. She is brilliant, full stop. She is also a loving, wonderful teacher and a dog lover, like I am. We're going to Westminster, girl. I love the whole package that she is. Lauri said I could tell you a little bit about my new adventure, and thank you for mentioning it. I left Legal Action Center to launch this National Black Harm Reduction Network to address the disproportionate impact of overdose mortality in Black communities. And a lot of people who have come through the mental health door in desperation, and navigating it is virtually impossible when you're also struggling. And so when they have been run up against barriers, can't find solutions, they take it into their own hands. And what we're seeing is just a mere dust, speckle of fentanyl on pills that both children and older folks are taking for relief, is wiping them out before their next breath. The mental hygiene arena is pretty mysterious to a lot of people, and it has its own laws and regulations that are not necessarily like health, but there's no question that you're doing healthcare work, which is about integrating health of the mind and body. That is what I'm committed to, and I will continue. I've done this work, and I know that Lauri will not stop being a ferocious advocate and protector, and I'm just so grateful to be in your orbit. Thank you.
So I first want to say thank you to David and Ira. You are wonderful. You have done a mitzvah, however you want to define it, for the better part of your adult lives, and I really admire your dedication and your spirit as father and son to these causes and to this work. So thank you. And to the committee that somehow, even though I'm incorrigible, found a way to validate and celebrate our advocacy and our achievements as an organization. If you know me well, you know I'm a pain in the ass, but I'm worth it. And so to the committee members that maybe even held their nose and voted yes, thank you. And then finally, to my friend Tracy Gardner, who, I'm going to say it again, National Black Harm Reduction Association. That's the name of the organization that Tracy has founded, and she is now the CEO of. And if you have any sense of outreach at the disproportionate, unbelievably deeply cynical space that we're in right now, where despite all of the reality, Black, brown, vulnerable, underserved people are dying disproportionately and for no reason. I'm a person who was raised and grew up on Long Island. I was middle class and had a good life. But 7 years ago, my partner Scott and my mother, in separate occasions, died of an accidental overdose. And so if I was fierce before, you can only imagine now. So I hope that you'll take a look at what Tracy's new organization offers and support it if you can. I think the reason that I'm here today is because recently we attracted a lot of publicity around the commercial rate mandate that some of you know we fought for 10 years. 10 years. Numerous times we wanted to give up, but we didn't. And all of this, all of our work as an organization is centered around access to care and continuity of care in the face of all of the barriers that are so pronounced right now and have been for so long. So I think that we got some attention on the commercial rate mandate, but our history of success goes back a long way, and I'm just gonna say it. I've been in this job for 22 years, and we have a really good accomplished record. One of the things that I wanted to tell you about that perhaps you don't know is that a couple of years ago, and this is really, I think, a demonstration of our organization. This is who we are. We are 165 agencies across the state, and we enjoyed a lot of really good relationships with government, etc. But we also make really hard choices, and we take on behemoths. And about 2 years ago, after knowing for a really long time that there was a provision in the contracts between the state and the health plans that requires the health plans to spend 96% of the money that they receive from the state to be managing care on actual services for Medicaid clients. That's a provision that went into the contracts of all the plans that manage our care. And we knew then, because I was in the room when it was put in, that it wasn't being enforced. It wasn't being enforced by the state, and the health plans weren't voluntarily sending back the money. And so after 25 foils across 6 state regulator agencies, including the controller, the governor, you name it, we confirmed what we knew, which was that there was hundreds of millions of dollars sitting with health plans that did not belong to them. Brett will argue with me about this, of course, but, and we were in the middle of 2 public health crises. And so eventually our organization, our members, our courageous members, agreed as a group to hire attorneys and to begin a litigation process, and we did. And maybe 2 Decembers ago, I had a conversation with Governor's lead counsel, with our lobbyist with me, and we basically said, sorry, I know you just got here, maybe it was 3 years ago, but we're going to sue you if you don't enforce that provision. And within a month, they were enforcing the provision. And that's to the credit of the Hochul administration for fixing something they didn't have anything to do with, and for the department and everyone else who finally said yes. So you can call it fair, you can call it unfair, but at the end of the day, there's been over $600 million appropriated in state budgets cumulatively. The first 3 years of which have gone to rate increases for the majority of outpatient ambulatory providers, not just clinics, OASIS and OMH providers across the board. And that is the courage, that is the strength, and that is the sheer ferocity that we have as an organization and will continue to have. And the only thing I ask of you today is you should follow us. Follow us and support us, because I am active on LinkedIn and I am telling you the story. I want you to hear it, I want you to know it, and I want you to join us. So I hope that you'll do that. I hope that you'll support our work. And I'm really grateful to be here and to thank you for this day. So thank you.
hard to follow. Our next presenter is Dr. George Petit, a board-certified psychiatrist and nationally recognized healthcare leader with over 30 years of experience advancing innovation in behavioral health and human services. He is the founder and CEO of Quality Healthcare Solutions, where he advises organizations on strategic planning, integrated care, workforce development, and crisis services. Dr. Petit has held leadership roles in government, managed care, and community-based systems, and he currently serves on several national advisory councils and boards, including our own in mental health news education, and brings deep expertise, insights, and passion to every role he takes on. Please welcome Dr. George Petit.
That is good. All right. Good afternoon, everyone. It's really nice to see everyone here today during the daylight and honoring such an amazing group of leaders in our sector. I've actually worked with all these honorees one way or another, which makes this a really special day because I know them personally and professionally. So congratulations to Ira, Lauri, amazing. Evan, I've worked with you as well. And PharMerica, I haven't necessarily worked with, but thank you for your support in really trying to improve the lives of individuals and families in the behavioral health and autism communities. So it's a pleasure. It's a little daunting. It's a bit of a challenge to introduce someone as accomplished, brilliant, and genuinely nice as Brett Friedman. I've had the good fortune of knowing him for over 10 years now, and in that time I've seen him navigate some of the most complex challenges in health and behavioral health with equal parts strategic brilliance and human compassion. Now, for those of you that have not been lucky enough to work with Brett, let me just give you a quick version, although his resume, if you see it, is not brief at all. So he's currently a partner at Ropes & Gray, where he advises clients at the cutting edge of healthcare innovation, government payers, managed care organizations, digital health startups, private equity investors, you name it. But before returning to private practice, he led one of the largest Medicaid programs in the country as Deputy Commissioner and State Medicaid Director for New York. So let's pause on that for 1 second. It's a $90 billion program covering more than 7.5 million New Yorkers, and under Brett's leadership, that massive system became a proving ground for some of the most innovative reforms in the nation, whether it was advancing Medicaid 1115 waivers, expanding telehealth during the height of COVID, or embedding value-based payments and social care strategy into the core of how care is delivered. But what I really want to emphasize is Brett's impact on the behavioral health sector, because we know as a policy and regulatory powerhouse that he is, he's also deeply, deeply invested in the human side of healthcare. During his time at the State Department of Health and beyond, Brett has pushed for reforms that elevate behavioral health from an afterthought to a priority. He helped guide integration efforts across physical and mental health, supported behavioral health specific value-based payment models, and advised on financing structures that better serve individuals with serious mental illness and substance use disorders. And here's something I personally admire. Brett doesn't just support system change at the high level. He gets into the weeds and thoughtfully shapes infrastructure that makes the work on the ground actually doable. A great example is the work that we did together at CPC, becoming a clinically integrated IPA, creating a joint venture and establishing a framework for contracting with payers. But I also want to call out his commitment to pro bono work and his role in providing the legal and policy backbone for the first overdose prevention centers in the US. This isn't just legal wizardry, it's truly leadership with a conscience. In the field where it's easy to focus on what can't be done or the negatives or the barriers, Brett is one of those rare people who sees the system's complexity not as a barrier, but as a challenge to be solved, and solved with creativity and a relentless drive to improve care for people who too often fall through the cracks. On a personal note, besides all the accolades, accomplishments, and multiple awards, including today's Healthcare Innovation Leadership Award, what I consider his most outstanding quality is his deep passion for improving the lives of those most marginalized and underserved. So, without further ado, please join me in welcoming my colleague, fellow champion in behavioral health reform, and genuinely one of the smartest and nicest people I know, Brett.
Thank you, George, for that really generous introduction, and thank you to Mental Health News Education for this year's Healthcare Innovation and Leadership Award. and congratulations to my fellow honorees, Lauri, who we definitely butted heads and always had with deep mutual respect. Evan, who I've known for years, Ira, and PharMerica. I'm honored to be in your company. As I reflect on this award, I want to point someone out who's actually here in the audience, and that's my twin sister, Erica. Erica is an oncological surgeon at NYU in Bellevue. And so in the family Olympic resume game, I'm definitely the silver medalist by far. When she was a young medical resident and I was a junior law firm associate, we'd play our favorite game together at night, who had the worst day? I would be like, oh, I worked 14 hours, I have the part to rewrite everything I turned in. If you knew Stephen Warnke, that was his MO. I ate 3 meals at my desk and I got yelled at by everyone. And she would be like, hold my beer. She's like, I removed the tumor, I spent 22 hours in the OR, and I stitched up someone's gaping head wounds. So yeah, she usually won. I used to comfort myself at those times and say to myself, well, at least I got to stay clean. There were no bodily fluids, there were no unexpected organs, just stress-induced rashes, paper cuts, and the occasional, and actually probably more than occasional, existential crisis. So when I transitioned to the Medicaid leadership role, I brought that perspective with me. I can work on issues, some of which George mentioned, like telehealth expansion, integrated licensure, reimbursement reform, like big system stuff. But it really wasn't in the trenches. There was this distance between me and the people who were on the ground doing the work. I was metaphorically and quite literally staying clean. The truth is, the real leaders, the real innovators, are those people on the ground, the direct care workforce. People like Erica, but also care managers, peer specialists, social workers, therapists, people out there in the field doing the hard work in the mess that is our healthcare system. And so, especially in these days of what I'll call federal uncertainty, let's keep fighting for the leaders and the innovators by seeking higher pay for everyone who's actually doing the work on the ground, by providing care that meets people where they are, especially when they're in crisis, offering services that are really integrated and person-centered, and achieving really what's better overall experience interacting with the healthcare system for everyone who we serve. So I just want to thank Mental Health Student Education again for this honor. I promise to keep doing the work, and I also promise to get a little dirtier in doing it. So thank you again, and really pleasure to be here.
Next, I'm pleased to introduce Debbie Patton, whose career began as a social worker and grew into executive leadership dedicated to expanding and integrating mental health and substance use services. Debbie has led major organizations like VIP Community Services and Outreach, serving thousands annually. She currently chairs the New York State Opioid Settlement Advisory Board and is a valued member of our Mental Health News Education Board. Her leadership and compassion have been a driving force in strengthening and transforming our community's approach to mental health and substance use care. Please join me in welcoming Debbie Patton.
Hello, everyone, and once again, I want to echo the thank you on behalf of the board for coming to this wonderful event. And each year, when we get to the table to say, like, who are we going to honor? We think we can't top the year before. We're able to do it. So again, congratulations to a wonderful group of awardees. I have the pleasure of introducing and honoring PharMerica. PharMerica is a pharmacy with over 30 years of experience serving the IDD, behavioral health, skilled nursing, and also senior care facilities. As a neighborhood pharmacy with national resources, PharMerica dedicated teams understand the complex medication needs of these communities. They focus on supporting clients and residents while reducing staff burden. They operate over 180 long-term care, home infusion, and specialty pharmacies across 50 states. Now, our connection on the behavioral health side to PharMerica is really through Joanna Jordell, who I hold my heart when I speak your name and your team. Your work, your partnership in this field with us is just unthinkable. We call you anytime and you guys are there for us. And in this work that we do, partnership is really the hallmark for us to be successful. As an account manager and a director of addiction treatment services at PharMerica, you're accepting this award on behalf of your company, and thank you. You have worked at PharMerica for 20 years, and you're originally from Brooklyn, Egg. You hold a business degree from the College of Staten Island, and you are dedicated to helping underserved New Yorkers access health services. In your free time, you enjoy spending time with your niece and traveling and attending sporting events. The behavioral health community values Joanne and her colleagues for their unwavering support and professional relationship. Please join me in honoring PharMerica.
Consider you a friend. Thank you, David, for this honor. I want to congratulate all the honorees and thank you for your hard work. I'm sure it's 24 hours a day, 7 days a week, and there aren't enough hours in a day for what you do. On behalf of everyone at PharMerica, I'm proud to accept the Corporate Leadership Award. It is an honor to be recognized by an organization that shares our goals of improving the lives of those living with autism, behavioral health challenges, and while supporting the agencies that we serve. I share this award with the dedicated pharmacists, pharmacy technicians, account managers, customer service representatives, and billing specialists who work tirelessly together to enhance the health and well-being of those we serve. Looking for a better tomorrow. Thank you, everyone, and have a good day.
Next, I'm pleased to introduce Marco Damiani, CEO of AHRC New York City since 2017. Under his leadership, AHRC supports over 15,000 individuals and families, continuing a 75-year legacy of social justice for people with disabilities. Marco's career began as a direct support professional and evolved into a lifelong commitment to full inclusion, health equity, and integrated care for neurodiverse communities. He played a major role in developing integrated care models and continues to expand comprehensive supports for those underserved by traditional systems. He has received numerous honors, including our very own Excellence in Autism Award in 2021. Please welcome Marco Damiani.
Thank you, David, and congratulations to the honorees. I'm really honored to call you colleagues and friends. You might wonder why I'm going to talk about Al Kaplan. Some of you know Al Kaplan. Al is and was and is a trusted colleague and friend. Al worked for many years in state government, in senior roles in budget, in the Senate, a former deputy commissioner of OPWD, and for a long time he was a senior policy advisor at AHRC New York City. I've been there long enough to say I've been there a while, and I've learned a lot from Al. I think one of the reasons I actually got the job was because of Al. What a great gift that was. And a few years into the job, he said, you know what, I think I'm gonna begin to retire. And I said, you know what, Al, I don't think that's a good idea. I'm still learning stuff from you. Hang around. He hung around a little longer. He said, no, I'm really gonna go. I said to myself, holy crap, I need myself a new Al Kaplan. Well, Evan Sullivan is my new Al Kaplan. If you've ever had the honor of knowing Evan and working with him, you know two things. First, he's one of the sharpest minds in Albany. And second, he's always checking with you. And I mean always. He's always calling. He's just checking in. What's up? Is everything okay? Any updates? Just want to make sure you're okay. Hey, I haven't heard from you in 20 minutes. You're still okay. And I'm not really exaggerating a whole lot. Evan calls me off the cuff a lot, and it means a lot to me that he does that. But honestly, if Evan weren't such a great strategist, he'd make a phenomenal therapist. His inbox should come with a warm blanket and a cup of tea. But that's who he is, someone who brings relentless dedication and deep empathy to everything he does. He's a fierce advocate for people with disabilities, a trusted partner, and someone who truly understands that public policy is about the people. So today, we finally get to return the favor, Evan. We're all checking in on you, and we're happy to say you're more than okay. You're extraordinary. Congratulations.
Thank you all. Good afternoon. Thank you, Marco, for those kind words, especially coming from you as a past recipient of the Autism Advocacy Award. And my sincere thanks to Mental Health News Education for this incredible honor. Standing here today is incredibly humbling, particularly being recognized alongside friends and colleagues and leaders like Lauri and Brett, Ira and PharMerica. Receiving this award is deeply meaningful because it reflects a dedication and inspiration, and the inspiration of remarkable individuals who do this work every single day, which I know we've heard a lot about. As I thought about my remarks for today, a story came to mind, one that I don't think I've ever told before, which, as Marco said, I talk a lot. Everybody knows I tell a lot of stories, and I like to kind of engage with folks. So, but this story really remarks being my journey into advocacy for people with disabilities. And believe it or not, it actually started on an ice rink. So in high school and college, I had the opportunity to volunteer as an assistant coach for a hockey team that was made up of entirely with players with disabilities. Every Sunday afternoon, at every practice and every game, these athletes lace up their skates and erase any notion of disability and had an infectious level of enthusiasm and determination. And I think the coaches and volunteers had just as much fun, if not more fun, than the actual players. This was something I really looked forward to on a weekly basis, and at a certain point in time, the team faced funding challenges, and this was something that I was really struggling trying to understand. I'm like, well, can't we just fundraise some money? Can we go talk to some people to get some dollars to help try to keep this going? And ultimately, we weren't able to continue, and it was something that was totally heartbreaking to me. But that experience stuck with me, and it was my first real glimpse at or into the systemic challenges people with disabilities face. So fast forward a couple of years, I was offered a role in the New York State Senate as Committee Director for the Mental Health and Developmental Disabilities Committee back when it was combined. I think this was probably the only time in my professional career I never once hesitated to jump at something. I said, absolutely, I will figure it out. I will drive back and forth to Albany. And this was something that was, I think something I enjoyed so much. So, in that role I learned very quickly, foremost, that policy victories don't just happen by chance, but they're really built on the courageous voices of the self-advocates, the unwavering dedication of the direct support professionals, the commitment of the provider agencies, and the relentless love of their families and friends who refuse to settle for anything less. So, I'm really feel honored to have the opportunity to work with the field to really advance our advocacy, especially following decades of, over a decade of budget cuts, chronic underinvestment, insufficient recognition for essential work that's being done. But I'm happy that our efforts are actually starting to make a difference. So a long road ahead, and as Brett said, I think we're entering a time of federal uncertainty, we'll call it that. But this is, I really feel honored to have even played a small part of, a small role in this. So thank you again for this honor, for your partnership, and for most of all, your unwavering commitment to improving the lives of our neighbors, friends, and loved ones with disabilities. Thank you.
So, wonderful afternoon so far. So we're here this afternoon because one person turned a personal journey. We're here this afternoon because one person turned a personal journey of pain into a powerful mission. My father, Ira Minot, took his own experience of recovery and transformed it into a lifelong commitment to bring light, understanding, and hope to others. The founding chair of MHNE was Dr. Alan Siskin, who served as CEO of the Jewish Board of Family and Children's Services until 2007. Unfortunately, Alan is unable to join us tonight, but he sent a message that he asked me to share with everyone. So this is Alan speaking. When Ira first shared his vision for mental health news education, serving both professionals and consumers, it was bold, ahead of its time, and a real challenge to pull off. I was moved by his willingness to draw on his own experience to create a much-needed source of education for both groups, highlighting what we knew and what we were still learning. He asked me to form a board to support governance and fundraising. Though I was leading a large agency at JBFCS, his clarity and commitment convinced me to say yes, and it remains one of the best decisions I've made. For years, Ira ran the operation largely on his own, steadily growing the publication's reach and quality. His dedication earned deep respect and made mental health news a trusted resource across the mental health field. While I regret not being able to join you tonight, I'm proud to congratulate Ira on this well-deserved recognition for his courage and hard work. Thank you, Ira, for including me in this journey. We also received a thoughtful letter from New York State Governor Kathy Hochul, which I'd like to share. Dear Mr. Minot, it is my pleasure to congratulate you on your retirement from mental health news education, your upcoming retirement from mental health news education, not yet. As the founder of this organization, you have pioneered health education through your publications, Behavioral Health News and Autism Spectrum News. By connecting patients, families, and providers with science-based resources, you have empowered people to understand and advocate for their needs. On behalf of all New Yorkers, I am grateful for your dedication to creating a brighter future for people with mental and behavioral health conditions. Sincerely, Governor Kathy Hochul. And finally, our final presenter this evening is Ashley Brody, CEO of Search for Change, a vital nonprofit serving individuals with behavioral health challenges throughout Westchester and Putnam counties. Ashley has devoted over 30 years to this organization, rising through the ranks from residential counselor to CEO, and has overseen significant service expansion and strategic growth. Beyond his work at Search for Change, Ashley serves on several regional boards and committees focused on mental health advocacy and community services, including chairing Westchester County's Community Services Board. His deep experience and commitment to advancing behavioral health services have made a lasting impact on the communities he serves. Please join me in welcoming Ashley Brody.
Good afternoon, everyone. It really is a privilege to be here. I regret that I missed this event last year. It's been a favorite on my calendar for as long as I can recall. But to be assembled among so many thought leaders and movers and shakers in our field really is gratifying, especially at this time for all the reasons that have already been articulated. I think we've coined a new phrase today, or a new euphemism, I'll call it, federal uncertainty. Yeah, we all recognize it's much more than that, and it's all the more reason why it's important for us to stay true to our shared mission. I can't remember the first time I picked up an edition of, at the time, Mental Health News. I suspect perhaps it was an experience similar to one Commissioner Sullivan shared. I was sitting in an office, perhaps our local Department of Community Mental Health, and I noticed a slender edition sitting on a coffee table. It was newsprint, printed on black and white on both sides, something we rarely see nowadays. I would venture a guess that most of the millennials in the audience don't even know what that is. But there used to be this document called a newspaper that was in hard copy in circulation. And Mental Health News at the time was one of them. Like Dr. Sullivan, I was struck by it because unlike many other periodicals with which I had become familiar that featured the rarefied voices of the nationally and globally recognized thought leaders, this included that, to be sure, but it included a multiplicity of voices. It included the voices of professionals, governmental officials, leaders, researchers, family members, and service recipients. What it was, in essence, was a community in print, and a community that really piqued my interest, so much so that when I read through it and got to the page that it included instructions about submission guidelines, I thought, well, I have a few things to say. And sadly, those who must work for me know that I have more than a few things to say. So I reached out to Ira at the time and inquired about the submission guidelines, and he got back to me immediately. And I figured nothing ventured, nothing gained, so I put together my best foot forward and tried to summon as much as I could recall from my research methodology classes and submitted an article. Well, lo and behold, astonished as I was, he published it and received quite a few positive comments. Well, Ira might have regretted offering that invitation to me because I think I've probably submitted a piece to just about every edition since then. Maybe I've missed a couple. And it's been so gratifying to me, not so much on a personal level, although it has been to be sure, but to just find myself included in a community of colleagues whom I respect so deeply. When Ira reached out to ask me to introduce him, I was beyond astonished. Again, as I sit here assembled before people whose names are widely recognized, whereas mine is not, I figured any number of you might have gotten this honor. So when he called me up and asked me to introduce him, needless to say, I said, well, if you're holding it on the moon, I will be there, to be sure. Ira, why? Why do you want me? I hold a prominent position in a small pond, but certainly there's other people who would be more than happy to stand up and to acknowledge the great work that you've done in this community that you've built through sweat equity over the course of a quarter century. And honestly, I think I was so flabbergasted, I don't remember exactly what his reply was, but I think it was something to the akin of, well, actually, you were there more or less from close to the beginning, and I appreciate what you do. Well, to that, all I can say is, Ira, I and everyone in this room more than appreciates what you do and what you've done. When you founded this publication 25 years ago, on your kitchen table, if I'm not mistaken, it was really born of your own personal experiences. As someone who dealt with a protracted and at times treatment-resistant course of depression, you knew the depths of despair. And you also knew that if you had had a resource like mental health news, behavioral health news at your disposal then, you might have been spared some of the grief, you might have been connected to a broader community that you have now created and assembled here. I'm sorry you were unable to experience that, you certainly deserved it, but you created it for so many other people. How many of us can say that a vision that we had that was born of some aspiration at our kitchen table, no less, becomes a true reality? Yours has. Not only is that deserving of the utmost admiration, you have built a legacy that will endure for years to come. As I said at the outset, and as many others have said, it's never been more essential than it is now. So I can say on behalf of everyone assembled here, all of your readers, everyone who's benefited from your publication, and you'll never know the names of most of them, I want to thank you. I want to congratulate you on a job very well done. We're all better for it. Thank you very much.
actually seemed a little, dumbstruck when I said I'd want you to present the award. And like he said, he said, why did you pick me? And I said, well, you go way back to the very beginning. He's been in almost every issue with a fantastic writing ability, and to zoom in on the subjects that are most important to the behavioral health community. And he's in my home turf in Westchester. I grew up in a little town called Harrison, and went through my recovery there. And I know that everyone should know and meet Ashley, because if you're doing any business in Westchester, he's doing so much for the community, and I want to thank you for this honor. When I founded Mental Health News Education 25 years ago, I could not have imagined the journey it would take me on, nor the incredible community of people I would meet along the way. So this honor is not just a reflection of my work, it is a testament to the collective efforts of everyone who has supported, contributed to, and believed in our mission. I have always believed that each of us has been put on this planet for a reason. For me, that reason has been to shine a light on mental health issues, to elevate the voices of those with lived experience, and to foster a community of understanding and support. I know that our work is far from being done, but I am so proud of how far we have gone together. My commitment to this work, as you know, is deeply personal. As many of you know, I endured a 10-year battle with medication-resistant depression, a time in my life that tested me in ways I could never have imagined. Out of the ashes of this terrible period in my life, one thing became clear. The key to my recovery was to focus on helping others rather than being consumed by my own personal pain. This realization became a guiding principle for me, and ultimately led to the creation of Mental Health News, which later became Behavioral Health News. By turning my pain into purpose, I found a way forward and a way to make a difference. Another thing I learned throughout my journey is that kindness is the key to life. If you want to be a positive presence on this planet, there's no greater gift you can give than kindness. It has the power to heal, to uplift, and connect us in ways nothing else can. Whether through sharing a story, lending a listening ear, or simply offering a word of encouragement, kindness is what binds us together as a community. And to truly make a difference, I had to think about other people. I had to get outside of my own head and focus on others and helping others. It is easy to be consumed by our own struggles and challenges, but the magic happens when we extend our hearts and minds to others. Behavioral Health News has always been about creating a platform for those who might otherwise go unheard. It is my hope that our work has helped people feel seen, valued, and empowered to share their truths. I want to just take a final moment to thank everyone who's been a part of this journey, our dedicated board of directors, our contributors, our thousands of readers, and the many organizations and individuals who have supported us over the years. Your belief in me and our mission fueled my passion and made everything possible. As I look to the future, I'm filled with gratitude and hope. Together, I know we can continue to find a way to end this vicious cycle of stigma, foster compassion, and create a world where mental health is valued and supported. As you heard, I'm retiring from Mental Health News Education at the end of this year. While I am stepping away from the organization I founded so many years ago, my commitment to helping others in the community remains as strong as ever. And as I begin the next chapter of my life, I remain deeply committed to the mission that has guided me for so many years. If there are ways I can continue to support this work at any organization, I would love to hear from you. Thank you for this incredible honor and for allowing me to be part of this vital conversation. Thank you. we started Autism Spectrum News. He said, Dad, he said, you know everybody. I don't know anybody. I said, how am I gonna do this? And I said, in time, you'll learn, you'll meet people. I said, it's like we used to call fundraising, friend raising. You know, you meet people, you get to know them. It's about personal. And I wanted to give David, come up here for a second, something personal that I have for him. You may not recognize this. You ready? It's a cup. What does it say? It says, world's best boss. And David gave this to me, I don't know how many years ago? You don't remember? I'm re-gifting it. I went from being the greatest boss to now him being the greatest boss. I am so thrilled at where he's brought this organization. I've been sitting around twiddling my thumbs while he's doing everything now. But I'm really proud of him and the work he's doing. I'm sure you all are too. Thank you for this. Thank you.
Thanks, Dad. So before we continue, we're almost done. It's time for a little bit of fun, our 50-50 raffle drawing. We have come to a total of $880, which is wonderful for us, so thank you all for supporting. As you know, the winner gets half the proceeds, and the other half goes to support mental health news education and our publications. So the winning ticket is $7703829. Give everyone a chance to pull their tickets out. Very good. Okay. Congratulations. You can have your prize in about the name tags. And to conclude the evening, Yvette Brissette from Unique People Services and wonderful board member of MHNE.
Okay. So, I stand before you this afternoon and I am the closer, right? I have the opportunity to sit on the board of Mental Health News and serve as the vice chair. I have been on the board for, I want to say, 8 years. And I have the esteemed pleasure of working with some fantastic board members. So, as we come to the close of this remarkable afternoon, I want to take a moment to reflect on the powerful stories, the unwavering dedication, and the transformative leaders that we have honored here today. Each of our honorees have left an incredible mark, I hope, in your heart today. The landscape of mental health news, education, and behavioral health care is at a pivotal point right now in this United States of America. The pandemic showed us how very vulnerable each of us in this room are. We can all reflect on stories about somebody that we knew that it impacted, right? If we look to the left and if we look to the right, according to statistic, one of us is suffering from mental illness right now. Lauri, you're a fierce leader. I've heard about you. I've sat around a table where you have been the conversation about your advocacy and the work that you have done in this field. You're a badass. And I am deeply honored that you were were recognized today for the work that you have done in this field. Lauri reminded us that advocacy is a personal issue. She described herself as being fierce after experiencing a personal issue with not only her partner, but her mother, right? And that has mobilized her. Not that she wasn't fierce before, but now she has taken on incredible tasks because it touched home for her. And it mobilized her to ensure that advocacy is heard. Brett, recognizing you this Friday. I don't have my glasses on, I'm so sorry, right there, okay? I don't have my glasses and I don't have contacts, so bear with me. Right? Recognize this afternoon with the Healthcare Innovation and Leadership Award, your legal acclimates and policy vision and reshaping access to care. And your work is a powerful and a needed resources today. Your innovative leaderships look like, in this field, you bring a vigorous hand and approach to every challenge, and your dedication to improving the system of care is needed, and we thank you. Evans, I remember when we were looking for honorees, and I remember as an agency that stands before you today that provides service in the DD field, how I look forward to your work, your agency work, and the dedication that your field brings to the DD, developmentally disabled field. I personally am thankful for the work and the advocacy that you have done. Now, as an agency that provide work in OMH, HIV and AIDS, you always put me in a difficult position because OPWDD got a longevity COLA. You know, I was giving out checks to my DSP for upwards of $20,000, $30,000. And then my rate went from X to X, increased by over 20%, all because the advocacy that your agency does. That's incredible, and that's worth recognizing. So we thank you. I personally thank you. Okay, so I got a little personal today, all right? PharMerica, we honored you with the corporate award this afternoon, and thank you for your work and your compassionate care that you provide. The gentleman that introduced you talked about you being there during crisis and you being someone that they can reach out and you providing a support to them. In the nonprofit field, when we have vendors that we work with, it is incredible that we can call on you when we're going in a crisis, and you represent that to that person that spoke. I don't have your name because I stepped out for another meeting, so I'm very sorry. But you represent that, and we want to say thank you. As nonprofit providers, we know how important it is to partner with our vendors for them to be there for us, because oftentimes they provide that little gap that we need to get by. So we thank you for the work that you do. Ira, the founder, the reason why we're here today. David, standing on your shoulder. You starting this from your table. You experiencing mental illness and recognize that you needed help. You giving a voice, creating a newspaper, right? Like Sullivan, and and the others, I'm from the newspaper era. You know, we're aging ourselves. I still get the Wall Street Journal delivered. Okay, guys, the paper. I still get it delivered. I still like to turn the page, right? And I'm thankful for that work that you have created. What an honor for you to be alive, where you're being recognized for your legacy. Ladies and gentlemen, what an honor. We're deeply thankful for you creating this. Awesome. David, you have a big shoes to fit. In Ira's speech, he spoke about kindness and the gift of kindness and what that did for him. You know, it's a simple word, but to be kind. In the work that we do as executive director, we are required and we're expected to be kind. We are required and we're expected to show gratitude. If you have been here over the years, Ira has given speech about that worker that was kind, that worker that impacted him, that worker that challenged him to create mental health news education. Each of you who are sitting here as a provider, think about the power that you hold in your hand to change someone's life. Someone did that for Ira, and that's the duty of care. That is the duty of kindness that is given to us as providers. So as I close today, I want to thank you for taking time out to be here. I always want to challenge you to join our publicity. It's online. We need you to subscribe, and not only for you to subscribe, but for you to send it out. I remember, and I'm going to talk again, right? I'm not a preacher. I don't know if you remember when Obama was running for president, and this lingered with me, right? I was moved as a young lady to be a part, right? I was energized. So I got on and I'm giving some money on my phone, and then it says, would you like to send it to someone? I said, okay. My whole people on my list then got an email from me encouraging to give. And 90% of my friends gave. Think about the power you hold by just sending our addition to your friend and what we can do for mental health news. So again, I thank you for coming today. Stay back, enjoy, and remember, share the news. Thank you.
Hope shines on in the darkest of days, a beacon of light guiding our way, fighting the stigma, breaking the chains, giving hope and strength to those who feel the pain, supporting mental health, addiction and autistic individuals, fighting for a better life, it's true. Coming together as a community, with love and understanding, we'll heal every heart. Shine a light